is located in the gut, and 90% of serotonin, one of the anti-anxiety, anti-depression neurotransmitters.
Start again. Tell me if you had some difficulty in starting again.
Oh, I'm being told that we had some technical difficulties. The storm that we had here last night really did a number on our electronics, our power, everything. So I'm going to start again with the introduction. Again, my name is Leisha Getson. The presentation will be about 50 minutes, followed by Q&A.
Okay. So
if you would like to submit a question, you'll see to the right of your screen a chat box. So you just type in your question and submit it.
when to talk and
Dr. Boyle is a board-certified OBGYN and has a Master's of Science in Metabolic and Nutritional Medicine.
She can't hear you, but I'm going to have to.
Dr. Boyle is also trained in medical acupuncture through the New York Medical College.
You've joined.
Dr. Boyle has a beautiful office in Montclair, New Jersey. It's called the Divine Awakening Healing Spa. She offers many wonderful services there, which I'm hoping she will enumerate at some point in the webinar. Dr. Boyle's practice is located at 736 Valley Road in Montclair, New Jersey, and she'll be providing her website. We're still having a little bit of technical difficulty, so I will just let you know about next month's webinar, which will be on Wednesday, July 22nd. Our presenter that evening will be Dr. Watchman. Dr. Watchman is a chiropractor. He provides the highest quality chiropractic care and clinical nutrition. He will be discussing Candida. What is it and how to get it under control? You'll learn about what other infections commonly accompany Candida infections. How do these infections cause a constant drain on your energy? The relationship of these infections and the multitude of physical symptoms they produce. You also learn how Candida infections can migrate to other tissues and become systemic, and how to test for Candida and much more. And that will be, as I said, on Wednesday, July 22nd.
For some reason, she's not on there. I can't get her on.
Well, unfortunately, we are still having some technical difficulties. It doesn't seem like we are able to get Dr. Boyle on.
Just give me 2 minutes. Let me see what I can do.
If you're seeing a screen, it has Dr. Boyle's contact information. As I said, her address, phone number, and website. I appreciate everybody's patience here as we're trying to get this set up. It is Doc G. I see your messages on the side there from Stephanie Mayberry. Yes, that is Dr. Getson working frantically to get Dr. Boyle connected here so that we can enjoy this wonderful presentation that she's put together for us. So in the meantime, if anybody wants to comment who was affected by the crazy storm that we had last evening. We are without power at our home. Things have been a little sketchy here at the office today with power, but many, many people are without power. Anybody there experience that last night? If we can't make this work this evening, we'll do it again, and of course it will be archived on our webinar page. And I do appreciate. So Rena says no storm in Bridgewater at all, and nothing happened in Coopersburg, PA. Well, you guys got lucky in where we are.
All right.
Oh,
So
there's
now
Dr. Boyle.
my slides popped up and left me.
Don't worry about the slides. Just
All right.
tell me what happens
So
when
the
you do it.
slides are on the bottom with my face on the bottom. So
Okay,
it says,
anyone?
Webinar Jam needs my permission to start, to
We can hear
continue.
Webinar Jam is asking her to continue.
Oh, she's there. Okay.
Yep.
Can you
Okay,
hear
are we
her?
ready?
Can you hear her?
Yes, Dr. Boyle, can you hear me now? Dr. Boyle, can you hear me? Nope, she can't hear me.
Okay, hang on. We got it almost.
Hang with us, guys. We're really sorry about
We
this.
got your picture, so now put the headset on.
All right.
Just forget about the phone. And we'll advance the slides, and all you have to do is say to Lisa next slide.
But how are you going to hear me if my headset, I don't hear you? I only hear you.
I can hear you now, Dr. Boyle.
You can hear me now? So
Yep,
you want me
I
to
can
hang
hear
up the phone?
Hang up your
Don't
phone.
hang it up yet, just put it down a second.
All right.
And talk through the headset. Let me see if she can hear you.
Yes, I can
All
hear.
right.
I can
You can hear me?
Yep, I can hear you great.
Dr. Boyle?
Yes.
Okay. Talk to her through the headset. She hears you, and just tell her when to advance the slide. And I'm going to hang up the phone.
Okay. So then I'm gonna hang up my phone. Okay.
All right, Dr. Boyle, sorry about that. We're finally on. I gave you a lovely introduction, and everybody sees your contact information. So without further ado, let's all have a warm welcome for Dr. Boyle. Thank you so much for taking the time to work through this this webinar jam that's new, and we're looking very much forward to your presentation. So whenever you're ready.
Okay. Thank you, Leisha.
You're
So I
welcome.
can't see my slides from here, so I'm gonna have to talk and improvise a little bit. But
Okay.
I have another set of slides, and thank you for inviting me.
You're
And
welcome.
for those who have joined that know me, I am Dr. Elizabeth A. Boyle, and we have a Divine Awakenings Healing Spa in Montclair, New Jersey. And tonight I've been asked to talk about food sensitivities, food allergies, and how they relate to chronic disease. So I think I'm going to start by asking the question, if you can advance the slide, have you ever had a gut feeling? You know, something is wrong because you feel it in your gut, or you feel sick to your stomach when you were anxious, scared, or nervous. Ooh, we'll advance the slide. And it might be because the gut, which is your bowel, corresponds with the brain daily through thousands and millions and trillions of messages. And if you look at the picture here, I hope Leisha's up with my picture.
Yes,
that
I
is
have
a
the gut up.
Okay, that's the picture of a gut. The gut is actually from your mouth to your anus. And basically what it is a long curly tube, next slide, where we're going to take in nutrition, absorb it, and utilize it for health. And then we're going to metabolize this nutrition along with metabolizing our hormones and neurotransmitters. And so what we'll do with the nutrition and the hormones and the neurotransmitters is we'll utilize it for what we need for what we have as bone health, to make strong bones, heart health, brain health for focus and memory. And then after we use that, we need to pass out the metabolites that are left over out of the body as waste. Next slide. So the gut is more complex than this, just utilizing what we take in and passing out as toxin, because 70% of the immune system is located in the gut, and specifically is located in the small bowel, to be exact. And 90% of serotonin, which is the anti-anxiety, antidepressant neurotransmitter, is made in our gut. So obviously the gut is complex. There's lots of messages going back and forth from the brain to the gut. And next slide. And that is why your gut is considered your second brain. These messages that are going back and forth are neurotransmitters, hormones, etc. And then the brain will respond by sending the messages back. And usually the little nervous system in the gut corresponds to the nervous system in the brain through, next slide, the vagus nerve. So the vagus nerve is the longest of the 12 cranial nerves. And it is the main channel where information is exchanged between hundreds of millions of our nerve cells in our intestinal nervous system and the central nervous system through the spine and the brainal cord. So we can advance that. So what is the function of the gut? We have to digest whatever we take in, whether it's food, whether it's something we drink, whether it's a vitamin, whether it's a drug. And then we have to absorb that and utilize it for what we need it. And then we have to metabolize it and finally excrete it. So that old adage, you are what you eat, is absolutely true. You are also what you drink or what drug you take, because this is going to affect our immune system, our nervous system, our hormonal system, our stress system, and so on and so forth. So we'll go on to the next slide. And I think if we talk about digestion, just so we're all on the same page, digestion, because it's from mouth to anus, starts with salivation. So one would actually need enough saliva and enzymes in the mouth to break the food down into smaller particles and present it to the stomach. But the stomach then must have adequate acid to emulsify the food particles in order to present the nutrition to the small intestine, where 70% of the immune system lives. So without a balanced acidity produced by the stomach cells, dis-ease or disease can occur. And so, we as humans should be alkaline on a whole, but our stomach should make enough acid to emulsify the food particles and to get it correctly to the small intestine, because then those microscopic cells of the small intestine are going to decide what's good or bad for us. So if you can advance to the next slide.
Okay.
And so everyone kind of knows that too much acid can lead to ulcers. And if you can see the picture that Lisa should be projecting, you can see the flame, inflammation. Too much acid leads to inflammation, and you can see the fire, the word flame. And ulcers is only part of the story, because if you go to the next slide, too little acid can lead to chronic disease. And the chronic disease can be from H. pylori, which is a bad bacteria that can invade the stomach. And if there's not enough acid to kill that bad bacteria, that H. pylori can be one of the causes of stomach cancer. We can lead to allergies or autoimmune disease. There can be what we call small intestinal bowel overgrowth, or affectionately known as SIBO, S-I-B-O. And symptoms of that are carbohydrate intolerance and immediate bloating. And SIBO happens when bad bacteria floats retrogradely back from the colon into the small intestine, causing the issues of discomfort. Dysbiosis is an unequalness, an unevenness in the bowel. And the other term for that is leaky gut. That's kind of the layman's term. And the medical term is malabsorption. So a dysbiosis or a leaky gut, when somebody hears that word leaky gut, they're thinking, oh my goodness, just diarrhea. But no, a leaky gut malabsorption can be either from diarrhea or constipation, or alternating diarrhea and constipation, which is irritable bowel syndrome, which is autoimmune. And if the leaky gut is taken further, irritable bowel syndrome, Crohn's, colitis, celiac, all can be an issue of the bowel. But then we also can have B12 deficiency, because if we have a leaky gut or a malabsorption, we won't be able to absorb B12 as much as we would need. B12 is one of our B vitamins that is good for our neurologic system. It's also good for energy. So if one is deficient in B12, one can feel sluggish and tired and chronically fatigued. But this comes about because of malabsorption. And then we can also look at mineral deficiencies, our minerals like calcium, magnesium, zinc, iron, chromium, molybdenum, manganese, and copper. And last but not least, God forbid, cancer. We can advance. Okay. And so too little acid, the medical term being hypochloridria, can give symptoms like bloating or belching or burning and flatulence within 1 hour after eating. It can even lead to skin rashes, acne, or an anal itch. It can lead to peeling, cracking fingernails, food sensitivities, or allergies. And some of the causes of low stomach acid is aging, if someone's going to fast for any long period of time, any viral or bacterial infection that can cause fever, any debilitating chronic condition, and antacids, sometimes antacid abuse or H2 blockers. And unfortunately, too little acid and too much acid give the same symptoms. So if one goes to a gastroenterologist with any of the bloating, belching, burning, any of those type of things, they're usually just given an antacid or a histamine H2 blocker, because that's the drug of the day, so to speak. We really don't have a drug for too little acid. We actually have a supplement. So we can go to the next slide. And so really you would want to determine if you have an imbalance in acidity. You would want to determine, is it too much acid or is it too little acid? And the only scientific way to determine stomach acid pH is to perform a relatively non-invasive test called the pH Heidelberg test. And this is really the only way to do it, because, invasive testing, when you go to a gastroenterologist, the gastroenterologist will put you under anesthesia, which is invasive, and then they'll do a colonoscopy or an esophagoscopy, which is to put a scope either through the mouth and snake it down to your small intestine, or put a scope up through the sigmoid and the colon. And that's really important because that's looking for visible disease. That's looking for ulcers, that's looking for polyps, that's looking for diverticuli, and it's even looking for cancer. And we really do need to know if we have any of that. But what they can't tell us is how digestion is properly or improperly occurring, because you can't see bacteria and you can't see enzymes or pH. So we can advance the next slide, and we do that through the pH Heidelberg test. And if Leisha has our picture of the pH Heidelberg guy, the poor guy, for demonstration purposes is not wearing any clothing, but this test you do come in fully clothed. You come in fasting, and what happens is you swallow a capsule which has a transducer, and this little thing that he's wearing around in the neck is a medallion. And if you can see right in the middle of his stomach, there's the capsule. It's a little orange, black, and a white membrane on the capsule. And that medallion helps one to follow that capsule with the transducer to see what the actual stomach pH is. And once the stomach pH is analyzed, the patient is given sodium bicarbonate, which is a salt, a baking soda salt. And then we sit and watch over time to see how long it takes the patient to acidify. If the patient acidifies too quickly, there's obviously too much acid. If the patient acidifies normally, then we really don't have a problem with acid. But if the patient takes a very long time to acidify, then the patient may have hypochlorhydria, which leads to digestive problems, digestive symptoms, and chronic disease. We can advance that slide. So once the food leaves the stomach, it's going to reach the small intestine. And that's where 70% of the immune system exists. And the immune system in the intestine is microscopic. And we really have a hard time knowing what's going on microscopically in our body. If we were to able to pick up everything that microscopically went on in the body, we probably wouldn't enjoy that either. But, we really have a hard time picking that up. So the immune system will respond to a particular food if it's inflammatory to an individual. And we have many inflammatory foods. Number one toxin nowadays is gluten. And gluten is a protein that is found in wheat, barley, and rye. And the root word of gluten is glue. So we can imagine what it does to the intestine. But it is the number one toxin. They're finding that gluten, which is this preservative, is responsible for some cardiovascular disease. And when you think about cardiovascular disease, and if we've ever heard of, and I've heard it on the news, and I'm sure you have too, where a teenager is on the basketball court or a teenager is on the soccer court, and they make a goal or a basket and they drop dead. And, you know, when you think about coronary vascular disease, a young person shouldn't have that. But when you think about a young person's diet, which the staple is sandwiches and pizza, which is gluten and dairy, you know, that's a toxin. And if they cannot adequately detoxify, that causes problems. So it not only causes problems in elderly, it causes problems in young children, adolescents, and even infants. And casein is the substance that one would respond to adversely if one were dairy sensitive. And dairy, remember, is anything that comes from a cow. You can go to the next slide.
Right.
So our immune system really has two antibodies that are important. It has an IgE antibody, which is a very quick antibody. And that antibody is associated with histamine, and that's associated with true allergy. And so if someone has a true allergy, they almost don't need to have a blood test because it's something that you can actually see. It's going to be immediate if histamine is being called in, and it's going to be redness or swelling, like a rash or hives. Your eyes will water, you'll sneeze. That's true allergy. And even without a blood test, you know, if somebody went out when there was a high pollen count and immediately their eyes watered and sneezed, they would say, I have an allergy to pollen. They'd be right. If they went to an allergist, the allergist would say, you know, we need an antihistamine. We're going to go against the histamine release. But if they did do a blood test, that would be the IgE blood test, and that's what most allergists do when you go into their office. But the antibody that is associated with a delayed reaction, microscopic in the gut, is IgG, and this is associated with a delayed reaction of 9 to 14 days. So if someone's going to react to something over 9 to 14 days and it's microscopic, obviously the symptoms are not going to be immediate, and we might take weeks, months, or even years before we actually exhibit the symptoms. So adequate testing for food allergens and sensitivities involves testing for both IgE and IgG responses. Now the IgE response, which is histamine release, obviously, you know, we've heard of children who have a peanut allergy and they have to sit at a different table because if they, God forbid, have that peanut, their throat will close. And, you know, that's the type of thing where we carry an EpiPen for because we need to open the throat. That's true allergy. But IgG is a sensitivity. And that's just as important because as sensitivities accrue over the years, that's what makes people ill. Chronic disease. You can go to the next slide. So how does inflammation occur in the bowel when it's exposed to such a toxin? So when the immune system recognizes a toxin such as gluten, which we already said was our preservative in our wheat products, and the wheat products are rye, barley, and wheat. It's not just wheat. It will respond by making a microscopic immune response. And this microscopic IgG complex will eventually settle on the microscopic villi of the small bowel. And that villi in the small bowel, those are just which are constantly wavering back and forth to act as actual toll gates, so that when we take in nutrition, we should use the nutrition, and when we pass out the toxins, we are able to pass them out. But if we have a delayed reaction where we're making these IgG complexes, they will actually settle on these microscopic villi and cause either plugging of the villi, which causes constipation, or they'll actually break open the villi, which will cause diarrhea, or an alternating constipation and diarrhea, which is irritable bowel syndrome, which is autoimmune. And so that's how an autoimmune issue starts with the bowel. If the autoimmune issue is staying in the bowel, we'll get irritable bowel syndrome, we'll get Crohn's, we'll get celiac. But if microscopically the little tiny complex leaves the bowel through the bloodstream It can attack the thyroid, and people would get autoimmune thyroiditis. It could attack the joints. People would get rheumatoid arthritis. Theoretically, it could attack the brain. You know, people would get multiple sclerosis.
Wow.
1 out of 12 people get 1 out of 12 people get autoimmune issues. And this is really how it starts, this delayed reaction, microscopic, that people experience for days, weeks, and even months after chronic exposure to the toxin. And so by the time they start to have symptoms, and their symptoms might be just as simple as bloating or as serious as joint pain, brain reactions, whatever it is, if it's autoimmune, this happened to be the upregulation of the immune system to cause the problem. Okay, you can go to the next slide. And so the cause of the symptoms was the upregulation, like I said. And if one doesn't recognize the IgG complex, it can take those days, years, months, whatever, to see that the state of inflammation is achieved. And that's really all autoimmunity is. It's a state of inflammation, and the word flame is in inflammation. So when anybody has an autoimmune issue, you have to put the fire out. That's the thing that you have to start with. And to put the fire out, you have to heal the leaky gut. So if the immune system starts reacting to now not only one thing, but now starts reacting to other things, not just gluten, maybe now gluten, dairy, eggs. So they're reacting to several things. That's the leaky gut. And then actually on a microscopic basis, the cells are separating a little bit. And so things are able to float through and get into the bloodstream and cause several other types of diseases. In celiac disease, actually, those villi are actually denuded. They're actually blunted so that they don't even have the ability to float back and forth and to assimilate the nutrition and pass out the toxin. Go to the next slide. So leaky gut is the layman's term, but simply a word for malabsorption. And if one is inflamed, and you remember that fire picture that we saw in the bowel, one will not be able to absorb the vitamins and minerals from the food that they need, and they will not be able to detoxify well. So this inadequate or impaired detoxification plays a part in leading to disease. Like we said, irritable bowel syndrome, Crohn's, celiac, ADD, ADHD, autism, autoimmunity, allergies, and cancers. Can advance the slide.
Yes.
Okay, so, real simply, metabolism in a simplified approach, what we take in, there we are, like the Rolling Stones, and then what we detoxify and eliminate and push out. But in between, there was a lot going on, just like I explained. There was communication between the endocrine glands. There's communication on a microscopic basis, and there's a defense and repair of immune function. So we'll go to the next slide. And then we find out that we're even more complex than this. There's really more to the story, because once the food is off and out through the small intestine, it's got to get to the large intestine. And that's where communication with microbes or bacteria will actually take place. So we have in the colon good and bad bacteria, and they are constantly at war. And we have to remember that we have more bacteria in our bowel than we have DNA. Actually, if you pat your belly right now while you're sitting here at your computer, 5 pounds of our weight is bacteria. And if I wanted to plate the bacteria of somebody's bowel, I could fill the length of 5 football fields.
Wow.
So we'll go to the next slide. And so we really look at colonization begins. Our mom carries us around in her womb, and our immune system is not even there yet. It begins with birth and breastfeeding, and then continues throughout life. So really from birth to the 3 months, the time we're 3 months old, that's when our immune system is forming for us. And if you look at that little diagram on the left, you can see that the stomach pH should be 1.3, like we talked about, and then from the stomach you get into the small intestine, the large intestine. But by the time we're where we need to be, we really have about 100 trillion bacteria. And 70% of the immune system is localized in that digestive tract, coinciding with that 100 trillion bacteria. That's accounting for half of the volume of contents of our colon. And you can go to the next slide. So, like I said, at birth, the digestive tract is sterile, but we get colonized with certain microbes in the first few days of life. In the first few days of life, predominantly are bifidobacteria, and especially with breastfed infants. The whole story, as you'll see on the next slide, changes with a cesarean baby versus a normal delivery, and the story changes when someone's breastfed or not. So, and then as you introduce foods, either at 3 to 6 months, depending on what pediatricians are talking about now, then the diversity develops in the GI tract. So you go from bifidobacteria to several other species of bacteria. And by now, of all the cells of the human body, the overwhelming majority are non-human, which is really strange, right?
That's scary.
So, yeah. So actually what medical studies are showing is that we coexist with our bacteria. It's not the other way around. And as you'll see on the next few slides coming, if we don't have the right bacteria, that will determine whether we have physical or psychological disease. You can go to the next slide. And in 2010, there was actually a study that revealed that infants born via the vaginal route colonized their bowel with beneficial lactobacillus, whereas babies born by a cesarean section acquired colonies dominated by a harmful staphylococcus. So in 2013, another Canadian study showed that a disruption of an infant's gut flora has been linked to inflammatory and immune problems like allergies, asthma, and even cancer. So right from birth, bacteria of the bowel is really important for our health, and it sets the stage for an individual's health. We'll go to the next one. Dr. Maria Gloria Domingos Bello is actually doing research, and she actually puts out this dictum that if one had to have a C-section, one should do the gauze method, which is take a gauze, collect from the mother's birth canal the bacteria, and when the cesarean baby is born, rub the gauze over the newborn's mouth and nose to more closely follow the bacterial population resembling vaginally born babies. Now that might sound strange, but when you look at the studies saying that, you know, the bacteria that the vaginal birth babies have versus the cesarean babies are at risk of more disease if this is truly panning out to be what research is saying. So we want to protect all the babies. And go to the next slide. And then if a mother can't breastfeed, because obviously you know that adage, the old adage, breast is best, still stands, because in the medical literature the benefits of breastfeeding are well documented. And studies show that if a woman cannot breastfeed, and it's not her fault, she should not feel guilty, but she needs to really kind of supplement the formula with probiotics to kind of confer protection against colic and irritability for the baby. But if you can breastfeed, obviously that would be the better way. So we can go to the next slide. So what do our gut bugs do? The bacteria, the good bacteria. Well, they do a lot more than we even think about. So they aid not only in digestion, but they create a barrier against potential invaders like viruses, parasites, and bad bacteria. Like we talked about in the beginning, one of the bad bacteria was H. pylori. And then they aid in detoxification. They can neutralize many food toxins. And they kind of, even if you want to think about this, one of my colleagues who actually wrote a book on it, say they act as kind of a microscopic liver, because the liver is a good detoxification agent for us. And so these little bacteria are acting as their own little microscopic livers. So we've got plenty of them. We hope to have plenty of the good ones. And they influence the immune system's responses, so they can prevent autoimmunity. So anybody with an autoimmune diagnosis will probably not have enough good bacteria. And that probably has to be looked at and corrected. They can produce and release vitamins and neurotransmitters. Actually, good bacteria help us make B vitamins. B vitamins are not only good for hair and nails, they're good for keeping us from being anxious and depressed. So if we do not have enough B vitamins, we might become anxious or depressed. They help us in handling stress because these little bacteria affect our hormonal system. And you'll see on the next slide how they actually do that. They aid in helping sleep patterns, and when people have insomnia, some of it might be due to digestion. You know, in Chinese medicine, we're really supposed to be asleep by 11 to 12 o'clock, and we're supposed to sleep for 8 hours. And we're really not supposed to eat for a couple of hours before we go to sleep, because our sleep is supposed to be our digestion of what we had during the day. We're supposed to work it through minimally. You know, we want to rest. If we're eating before we go to bed, then we're digesting and working while we eat. And so that can cause people to wake up during the night. It can also cause people to wake up tired in the morning. And the gut bugs can decrease inflammation. And we said all autoimmunity is a big state of inflammation. Next slide. And this is kind of interesting that if you looked at the two most common organisms in the colon, we have firmicutes and Bacteroides. Firmicutes are your fat-loving bacteria. So they are more efficient at extracting energy from food, and calories is energy. And research has shown that obese people have elevated levels of firmicutes in their gut flora. So the ratio of firmicutes to Bacteroides is critical for determining the health or risk of illness, and changes in the ratio of the bacteria can change expression of your own DNA. And so that ratio can be obtained from a stool analysis, a comprehensive stool analysis. You can go to the next slide. So the good bacteria is going to help us balance blood sugar. When firmicutes are reduced, so is the risk for obesity and diabetes. Exercise, actually, we don't think of it this way, but it affects our gut microbiome by favoring colonies of bacteria that prevent weight gain. So they did lab studies on mice, and higher levels of exercise with the mice correlated with a reduction in the firmicutes and an increase in the Bacteroides, which correlates with what they showed for obesity. And so then that brings up the concern about abundant use of antibiotics in children, because antibiotics not only kill the infection, but they kill all the good bacteria in your bowel. So if one doesn't replace the good bacteria, 1 week of an antibiotic takes your body 6 months to replenish that good bacteria, unless you take adequate probiotics to speed the process up and get that good bacteria seeding. So if a pediatrician doesn't start a child on a probiotic and has them on multiple courses of antibiotics, maybe for tubes in the ears or throat infections that might be even viral, but they're not sure, so they use an antibiotic, the concern is, can this lead to childhood obesity? And now we look around and we see that our adolescents now are becoming diabetic, which is scary, because type 2 diabetes used to be a disease of people who are over 40. And now people at age 12 are getting it.
That is really frightening.
So we can go to the next slide. And then our gut bugs make serotonin, and serotonin is a neurotransmitter. And serotonin and GABA have to be balanced to decrease depressive symptoms. So if we have enough good bacteria, we would make serotonin. Remember, I stated in the beginning of the lecture that 90% of serotonin is made in the bowel. So if we don't have enough good bacteria, we're not making it. And then we don't have enough serotonin, we don't communicate with the brain to say to the brain, don't be anxious, don't be depressed. But if we have enough good bacteria, we can give that signal and that message. So we can go to the next one. So what makes the bowel sick? What makes a sick gut? Poor diet, obviously. We talked about medications like antibiotics. That story in and of itself is overuse is really painful to think about, because, we have more and more people who, the minute we get a sore throat, they want to turn to an antibiotic, or the doctor will give them an antibiotic. But here's what's interesting. Oral contraceptives increase the risk of Crohn's disease 3 times. Now, they don't know, is this due to a hormone changing the permeability of the intestinal lining? That's the hypothesis, and probably it is. So that means that the estrogen and the progestins, which make this drug, which are not natural, can change the gut biome. And then nonsteroidals, which are anti-inflammatories, increase the damage to the gut lining, especially in the presence of gluten. And then infections can do it, because if you have an infection with bacteria or a virus, you're going to have an issue. Toxins like metals and molds. We are exposed to metals every single day of our life. Sitting in front of this computer here, we are all exposed to cadmium. Smokers are exposed to cadmium. So every day we're exposed. Our phone. What did we do without our cell phones? Well, we'll know in the future what we should do without our cell phones. But it's a toxin. There's metals involved in this. The Wi-Fi exposure is a toxin. When you travel on a plane, you're exposed to toxins. The list goes on and on. Inadequate digestive enzymes, like we talked about, the altered pH can cause the microbacteria to be imbalanced. The imbalanced ecology, if you have too much of a bad bacteria, too little of a good bacteria. The impaired intestinal epithelial barrier, which is the leaky gut. And if you have altered neuroendocrine balance and autonomic functions. We can go to the next slide. And the other things that keep affecting the gut bacteria, like we said, the Western diet, the standard American diet is SAD, S-A-D, usually because it's low in fiber, fruits, and vegetables. And artificial sweeteners like saccharin, sucralose, and aspartame can affect the gut bacteria. And so it's really best that we not use those. While they do not raise insulin, they favor dysbiosis, the unequalness in the bowel, because they change the microbacteria and they create blood sugar imbalances. Aspartame, however, which is found sometimes in, they call it the natural juice. I can't even think of the name. I'm blocking, and I shouldn't probably put anybody down. But aspartame is neurotoxic, and actually, I have a colleague who has a daughter who is a pilot, and she told her mother that you have to sign a release that you will not use aspartame because aspartame can cause seizures, and it definitely would not be good if our pilot had a seizure while we were on that trip, right? Or anybody.
That's for sure.
And then high fructose corn syrup, everybody says, oh no, that can't be bad for you. But the reason that it's bad for you, because everybody says, oh, it's fructose, that's good. But the reason why high fructose corn syrup, and that's found in ketchup and some condiments and all of that, ketchup is mostly sugar, is because gases are created when the gut bacteria rapidly ferment those high fructose syrups, causing bloating, abdominal pain, and discomfort, which is not comfortable for people. So we'll go to the next slide. And then, what makes the gut sick is the toxic burden. Like we talked about, the toxic burden can come from skincare products. Remember that the skin is the largest organ other than, the bowel. The two of them are, good detoxifiers. So if you're going to detoxify through the skin, you're also going to absorb through the skin things that might not be good for us. So we have to be careful of what we choose in our skincare products. And most of us might not even think of gluten being in a skincare product. But if you actually look at your ingredients, you'll see a lot of skincare products have wheat. And what's the preservative in wheat? There could be some gluten there. So unless a skincare product says gluten-free, especially if someone has celiac or is gluten sensitive, even that can affect them. And then the air has certain toxins, as we all know, with the pollution. Water, and even bottled water, when it's in a plastic bottle, can have these fake estrogens that they leach into the water. So, you would want your purified water, and obviously you wouldn't want the water in a perfect world in plastic. You would want it in bottles, but it doesn't always happen, we know. And because it doesn't always happen, we really need to decrease the toxic burden and detoxify as much as we can. It happens with pesticides, the food and soil, and then the cleaning products that we use. If you want to use a better cleaning product, you have to really look at what those ingredients are, because it's very toxic at times. And we can go to the next slide. And, if you want to look at the diet and you say, well, what do? I go, and everybody says to me, it's so expensive. I can't get everything organic. And I said, well, as much as you can, please do. Because, in the long run, your health is going to be better for it. And people go, oh, no, that's not true. But it is true. Because if something is not organic, then that means there's more pesticides. So to help you kind of differentiate, say you didn't want to get everything organic because it was so expensive, there's something like the Dirty Dozen and the Clean 15. The Dirty Dozen being apples, celery, cherry, tomatoes, cucumbers, grapes, hot peppers, nectarines, peaches, potatoes, spinach, strawberries, and sweet bell peppers. And plus you can see down there what they add. The Clean 15 are considered that because most of them, as you can see, like the avocado or the eggplants or the grapefruit, have a hard covering on them. So even if they did use certain pesticides, it wasn't penetrating as much. So, if you go by that list, it's a little bit easier to decipher because it can get confusing, and it can get expensive, but really we're worth it. Our health is worth it. And I guess on the end of that slide, you can see foodnews.org, so you can learn more about pesticides. And you probably want to learn as much as you can because you would be surprised at what we actually are using. Even things that are sold on Amazon, some of the pesticides there are neurotoxic. So we can go on to the next slide. And environmental chemicals like that tend to be lipophilic. They love fat tissue, and they love endocrine gland tissue. And that's why disease occurs in the thyroid. That's why disease occurs in the ovary. And that's why when people are heavier set or obese, and that they can get more toxic. And so when somebody does go on a weight loss program, remember that you're releasing toxins into your body by losing weight. I mean, yes, you want to lose weight, but then you have to remember you want to properly detoxify because you're putting some toxins into the body. So when the liver gets overloaded with toxins to process, it's going to be much less effective at clearing toxins from the body. And the liver is one of our major detoxifiers. We need our liver to live, and we need it really to be a great detoxification for us. So if we're going to overload the liver with chemical stuff or alcohol or cigarettes and stuff that we have to continually, and even estrogenic stuff, like I said, when the plastic bottles have those fake estrogens, they're called xenoestrogens, Xeno estrogens, we have to break them down. So if a woman or a male can't break it, because remember, men make estrogen too. So if a woman or a man can't break their estrogen down properly, they're increasing their risk of breast cancer. They're increasing the risk of prostate cancer. Breast and prostate are similar tissue, and so it's best for all of us not to be estrogen excessive. And then the chemicals in the water supply, like chlorine and fluorine and all those heavy metals that they use to clean the water supply, can actually change our gut microflora. So we can go to the next. And so, sometimes doing a comprehensive stool analysis can actually give you a lot of information. There's a company, Genova, and Doctors Data. There's many companies who, although they're not usually covered by insurance, will look for infection, will look for inflammation, and there's certain markers for inflammation, like calprotectin. They look for fecal fats and protein products that are actually malabsorbed and passed out into the stool. And then they actually look at the imbalance of bacteria. They actually look at the firmicutes to the bacteroides, that ratio. They actually look at how much good bacteria you have in terms of bifidobacteria and lactobacillus. And it can be very helpful. So if we go on to the next slide. That's not quite the stool sample we had in mind.
That's cute.
Okay. So, the stool sample is a bit messier than that. You do have to collect, your stool. And, but if you do it the right way, it gives you a lot of information. And so we can go to the next slide. So how do we increase our gut bacteria? Because now we know how our gut was sick. Now, how do we increase it? Well, we want to choose foods that are rich in probiotics. Probiotics are the good bacteria. So that's the live cultured yogurt. But the problem there is if somebody's dairy sensitive, what do? They can't have it. And if they are choosing a yogurt, and any of you who eat yogurt out there who are not dairy sensitive, I'm going to tell you after this lecture, go to your refrigerator and look at that label and look at the carbohydrate and sugar content. You may be appalled, you know, and sugar feeds yeast. Okay, so even though, you know, it's supposed to be great for us for probiotics, probably, I'm dairy sensitive, by the way, so I take my probiotics through a pill. I don't take it through the yogurt, but coconut yogurt is an option because coconut is a good fat, but you have to remember that you have to read those labels because a lot of them, even at Whole Foods with coconut yogurt, give a lot of sugar. There is a company that does cocoa kefir, and kefir is next, which is the lowest amount of sugar in coconut yogurt. Kefir is similar to yogurt. It combines the yeast and bacteria in goat's milk. Tempeh, fermented soybeans. Fermented soy is different than regular soy. Regular soy is estrogenic. And so if we overdo soy milk and soybeans and all of that, even in our young kids, we can estrogenize our boys. And so fermented soybeans are a good source of B12. Sauerkraut, fermented cabbage, fuels healthy bacteria. Pickles. Pickles are a probiotic. So that is no wonder why pregnant women sometimes crave that for a reason. They kind of know that they have to have a good thing for their baby. That probiotic for them gives them better B vitamins, gives them better detoxification, so gives the baby better stuff. Pickled fruits and veggies, but not pickled in vinegar. Vinegar is very yeasty, so you would want it pickled in brine. And you look down there, I made a little asterisk what brine is. It's really distilled cold water and pure sea salts, and depending on whether you like it fine or coarse. And then cultured condiments, which guacamole, salsa, mustard, lacto-fermented mayo, and then the fermented meat, fish, and eggs. So you can go on to the next slide. And the probiotics that I usually choose when a patient comes into my office are these 5. I actually have a product here that I recommend, which contain these 5. And these are the 5. Lactobacillus plantarum. That's the thing that's found in sauerkraut and cultured veggies. And absorbs and maintains vitamins. Lactobacillus acidophilus, which is found in fermented dairy products and yogurt, and curbs candida and maintains cholesterol levels. And, you know, in gynecology, maybe your gynecologist tells you when you get a yeast infection, take acidophilus, because it does curb candida, and it's all well and good, but it doesn't protect everything else in the bowel. And remember, the same good bacteria that you have in the vagina, you have in the bowel, so you want to protect all the good bacteria, not just acidophilus, because then that creates a different type of imbalance. Lactobacillus brevis, which enhances the immune system. Bifidobacterium lactis, which is found in yogurt. And that lactis actually kills salmonella and other diarrhea-forming foodborne pathogens. And then Bifidobacterium longum, which was one of the first bacteria to colonize our bodies at birth. And that improves lactose intolerance and food allergies. And that's why when Bifidobacterium is the one that the babies that are vaginally born or breastfed, they do better with less lactose intolerance and food allergies. Not to say that they can't have it, because something else can cause a change in their microbiome, but they're at a better advantage. So we have to give our C-section babies a good advantage too. So you can go to the next. And can we start these probiotics at birth? Absolutely yes, because infants, they were studied, who were administered probiotic therapy do better against allergies and food sensitivities. So you can add a probiotic to breast milk that's pumped or to formula. And the 2 for infants that are most popular is the Lactobacillus rhamnosus GG or LGG. And that can treat infectious diarrhea in children as well as protect them. And the kids who take this in studies were half as likely to develop eczema than those who took a placebo. And then Lactobacillus reuteri, which decreases colic. So we go to the next. So how else can you increase your gut bacteria besides the probiotic? Well, my goodness, here we go with another something. We can do a prebiotic. Okay, so prebiotics are food for the probiotics. We're getting very technical now.
Yes.
But prebiotics they have to be non-digestible. They must be able to be fermented or metabolized by the intestine, and that has to confer health benefits. So something that is a prebiotic is inulin, chicory, Jerusalem artichoke, onions, leeks, garlic, Mexican yam, raw asparagus. Those are things that are going to feed and nurture your probiotic, which is your good bacteria. Now, the prebiotic becomes most important in people with SIBO. Remember a couple of slides ago when I said small intestinal bowel overgrowth, SIBO, not only would a probiotic be helpful, but the prebiotic would as well. So you can go next. And what benefits can we get from prebiotics? Well, we can reduce fever or febrile episodes in infants. We can reduce inflammation and bowel disease, enhance absorption of minerals, lower risk factors of cardiovascular disease. They can promote a sense of fullness or satiety so people won't reach for the carbs, which will feed the yeast. And they reduce glycation. What glycation is, glycation increases free radical release, and free radical release can trigger inflammation and lower insulin resistance. And insulin resistance compromises gut lining. So you can go forward. And now we have another form of imbalance that we can get to in the gut, which is really probably distressing all of you because you thought, well, you had it down and now your gut is going to be clean. But some people, you know, have a histamine intolerance, and it's not really a true food allergen. You know, that's why you really have to do the proper testing and be seen and to differentiate what you really have, because even though we say these are things you can do, it might not be for you. Everybody's an individual. And so histamine intolerance can give headache, vertigo, dizziness, nauseousness, vomiting, nasal congestion, runny nose, wheezing, shortness of breath, arrhythmias. You know, histamine is histamine, so, you know, it's going to induce an IgE type effect, a true allergy type effect, but it might not be that IgE true allergy. And diarrhea, bloating, gas, flushing, hives, itching. So we go to the next. And histamine intolerance can closely resemble food allergy. There are some foods that are histamine releasers, and then there are some foods that are just histamine rich. And you can look at this list, and you can see that some of the foods that are very good for us, like avocados and spinach and eggplant, actually release histamine. And that can make somebody uncomfortable, feel uncomfortable. Vinegar, mustard, fruits, shellfish, and histamine-rich, of course, is the sauerkraut, the tomatoes, the ketchup, alcohol, wine, and beer. So if we go to the next one, what I just talked about on that other slide with that little picture, what histamine intolerance looks like. Skin symptoms, you know, headache, mental fatigue, joint discomfort, panic attacks, especially after a meal, exhaustion during or after a meal, chills and shivers, difficulty catching breath, and symptoms after certain foods. So you go to the next one, and there's a short test you can take for yourself, you know. Here's the symptoms on the left. Do I experience any of those symptoms? If I do, is it never? Is it once a month? Is it once per week? Is it daily? Is it always? And then you score yourself. 1 to 10 would be mild histamine intolerance. 11 to 23 is moderate, and 24 to 36 is severe histamine intolerance. So if somebody is really severely histamine intolerant, we probably think about they might be lacking an enzyme called diamine oxidase, DAO. And this is the enzyme that we all use to degrade histamine. And it's a blood test that can be done from a specialty lab if someone really is thinking, leaky gut, diamine oxidase, what do I need to do? And then if you do have a diamine oxidase deficiency, there are certain supplements that we can recommend to help with that. Next slide. So to deal with chronic illness, the key is fix the gut, fix the bowel by improving the diet. You want nutrient-dense diets, essential fatty acids, fiber, phytonutrients. You want to support digestion, which we talked about. Pancreatic enzymes might be helpful, but definitely betaine hydrochloric acid plays a big part. You want to support the normal flora, which entails prebiotics and probiotics. You want to repair and regenerate amino acids like L-glutamine, can repair, and theanine, which is a green tea extract, can also repair. If someone is having mental issues like Alzheimer's or MS or, something that's going to affect the brain and excite the brain, they probably wouldn't want to take the glutamine. They would probably go more toward the theanine, because glutamine can be changed to glutamate in high doses. Usually when we heal the bowel, we don't use the high dose that would affect the brain. But, everyone's individual. That's why, we make suggestions, but you really should be seen and tested. Immune modulators like nutrients, antioxidants, and herbs. And obviously remove the infections and toxins. And how would we know we have them? By a comprehensive stool analysis. So we'll go to the next slide. So we really want to balance. And balance is the yin and the yang of it all. The mind, body, spirit, if you will. And if you go to the next slide, I will talk a little bit about oils. Essential oils, if they are 100% therapeutic grade, can impose energy and health, increase a positive mood, and decrease anxiety. They can help the digestive system, and they can create a relaxation response. If the essential oil is 100% therapeutic grade, it is a healing oil. It can even change DNA. So you can go to the next. And so some of the oils for digestion could be peppermint, caraway seed, tarragon, and these oils can be diffused. These oils can be inhaled. Some of them, not all of them, can be ingested in a gel cap. Go to the next slide. Bergamot is another oil for digestion because it will stimulate digestive juices. But bergamot does tons of other non-digestive things as well. But it can have antibacterial effects, fight food poisoning, stimulate intestinal contraction, help gum health and infected teeth, and kill intestinal worms. And you can go next. Young Living Oils has something called Digize, which is a mixture of tarragon, ginger, peppermint, fennel, anise, lemongrass, patchouli, and that is an excellent oil, that mixture, which you can actually put right on the skin around the belly button to help decrease intestinal discomfort. Coconut oil is, and fish oils and all of that are other oils for digestion health, but they are not essential oils. Essential oils can actually penetrate the skin. Coconut oils and DHEA usually do not, but the coconut oil is heat stable, so if we cook with that at high temperatures, that would be good to do. Extra virgin olive oil is good to do. DHA from either a fish oil or an algae is good to do. And we'll go to the next slide. And so if anybody has any intestinal issues that affect the brain as well, vitamin D3 deficiency is that red flag. Actually, vitamin D3 and B12 deficiency. So we should all have our vitamin D3 levels drawn, as well as the B12 drawn. And we should know that vitamin D3 is not just a vitamin, it is a hormone. And it is a hormone that protects women against breast cancer, protects men against prostate cancer, protects against certain lymphomas, protects against depression and anxiety. So it does so much, and we find so many people deficient because we're supposed to have vitamin D from the sun. And when we go into the sun, we put on sunscreen and we block 100% of vitamin D production. So we have to really supplement. And even if you don't wear a sunscreen, if you're not afraid of skin cancer, and there's a debate whether that actually causes or protects against skin cancer. I know we can go that way, but I'm not going that way.
Okay.
But if you let your skin turn pink, once it's pink, you no longer make vitamin D. So when someone is tan, they're not making vitamin D.
Oh, how interesting.
So vitamin D deficiency can lead to autoimmunity, and deficiency in vitamin D3, like I said, is a red flag for bowel imbalances. So the average child and adolescent and adult who is not deficient should take 2,000 international units of D3. But obviously, you're deficient, a lot more would be necessary. So we would go to the next. I just wanted to say thank you to some of the labs that I used and that I do use, and some of the doctors that, from their books and from their teachings, because they are mentors of mine. So I do say thank you to them and give them credit. We'll go to the next slide. This is a picture of our logo, Divine Awakenings Healing Spa, and our last side is our spa. So if you need Divine Awakening healing, you can always make an appointment. And some of the things that, most of the things, all of the things we talked about here, we offer in the spa as well as other things for healing. So I thank you very much for listening. And I guess if there's a question, I hope to be able to answer it.
Yes, there are several questions. I just have to say that was so much, so informative. I'm going to be going back and listening and watching that again. It seems to me like this is a missing link, that it's something people are just not paying attention to, this connection in our gut to all of these diseases, and especially the autoimmune diseases that are happening everywhere.
That's correct.
Just so important to get it. And I think what you're saying is by doing the testing, of course you do the testing at your office for the food allergies.
Right.
And was that the IgE and the IgG?
That's correct.
Okay. So instead of just trying to take this on yourself, see a professional like yourself to have the testing done. And so you know exactly what you're taking, why you're taking it, and the correct amounts. And
right, because you know, I do have patients who come in and say, you know, my friend came here and they took this and they got better, and look, I'm taking it and I didn't get better. And I said, because you're not your friend.
Right.
You know, you are an individual, and there are so many steps along the way that something can change. So we do the proper testing and we look at somebody as an individual. And although some things might be similar, it might not be the thing that that person needs. And so that's kind of when you're guided to what you have. And a lot of genetic testing is done here too. We can do genetic tests for many things now, you know, whether you're taking a medication and you want to know if it's right for you, you know, because a lot of times even medications that people are taking, like statin drugs, which we won't go into.
We won't go in there.
But genetically, they shouldn't be taking it. You know, because it could cause a cardiomyopathy. So, you know, like that's the problem when we try to self-diagnose and self-treat. So our goal is to help others, you know, just get through on their journey to health.
That sounds fantastic. So I'm just scrolling down. We do have several questions. There were some conversations going on. It's starting, looks like, is going gluten-free advisable for everyone?
In my opinion, yes. Gluten is the #1 toxin. We would all do better without it because it, you know, the root word of gluten is glue. Look what it does to our intestine. And like I said, what goes on with the young kids today? I mean, you're seeing these young children and adolescents have heart disease, you know, and diabetes. Something's wrong. Something's wrong there.
Very, very wrong.
So we have to remove toxins, and gluten is the #1 toxin. Proven. It's a proven toxin.
Right. And somebody did comment saying only 7% of people are actually allergic to gluten.
That's probably correct. But I bet you 85% are sensitive to gluten.
Yes. Okay. And somebody said, I believe even food sensitivities can compound and cause damage.
That's true. Probably more damage. I mean, if you're truly allergic, you're going to see it. You're going to stop taking that. So you're done with it. But if you don't know that you're sensitive and you keep exposing your body to it and your immune system to it, over time that accumulates to disease, autoimmune disease. Right. And you know, if you don't stop that autoimmune process in its tracks, one autoimmune problem begets another, begets another, begets another. So by the time a child who's 10 has eczema and allergies, which are 2 autoimmune issues, if you don't heal the bowel and stop that, by the time they're 25, they could have 5 or 10 autoimmune issues.
Oh, wow.
Some which could be debilitating, like MS, you know. Yeah. So it's something that really should be taken seriously for the health straight from the womb. You know, anti-aging begins in the womb. You know, we age from conception. Yeah. And so if you want to age optimally, that's what we should be thinking of. And I think really what is not happening as much as it should, I think it's happening now with at least people who come to me, is they're thinking of keeping their children healthier because it has been predicted that this might be the generation where children die before their parents.
Yeah, very frightening. So somebody also asked or commented that vinegar and water is a great antibacterial cleaner.
Vinegar and water has been used as a douche for years. So it can, you can use it to clean the vagina for bacteria and yeast, betadine as well. But remember that if you are doing it that way, some of the bacteria can get up into the uterus and out through the tubes and infect things. So, so you go back and forth if they're referring to it as a douche. If they're referring to it as taking vinegar and water, you got to be careful because vinegar is very yeasty, ingesting it.
Right. Okay. And, a lot of people take that Bragg's apple cider vinegar.
Mm-hmm.
And I've heard that, good and bad.
Well, it's good and bad. I don't think that it's all bad. But remember, if you're going to do that, do it through a straw and dilute it because it will discolor your teeth.
Oh, thank you for that information. I love that part about the women creating pickles when they're pregnant. It's so, that's just...
Makes sense, right?
It just makes sense. Yeah. It's just, we just know. I think we know intuitively, but we've stopped listening to what we know.
Right.
Yeah. So somebody said, will a vinegar and water bath for conventional produce reduce the pesticides?
It's supposed to, but I would rather you do organic.
Right. If you can, just do organic.
Yeah.
Right. Okay.
And anyway, I think it would change the taste.
Right.
Make your stuff vinegary and, and that's yeasty. So, a lot of people have yeast in their bowel and then, we want to take the yeast out. And are we doing that?
Right.
So
I know I can't find the question right now, but it came early when you had mentioned MS.
Right.
Something that you had said for MS. I'm scrolling through the questions trying to find it. Can you just address? It had to do with the gut and probiotics, I believe. What was the statistic you gave on MS? Do you recall that, Dr.
I didn't
Boyle?
give a specific statistic on MS. What I said is 1 out of 12 people get autoimmunity today. And one of the autoimmune issues is MS. And more people are being diagnosed with MS. And MS is an inflammatory brain condition, which can be debilitating, chronically debilitating. And, you want to heal the gut and get them gluten-free as quickly as possible. There are other modalities that we do for MS patients. You can do hyperbaric oxygen. You can do some compounding, low-dose naltrexone. You can do, they do studies on high doses of biotin. I mean really high doses of biotin. So there's various things that you can do in an integrative functional level, as well as what you're doing, with your doctor if you have MS.
There's some good tips.
Cleaning the gut is key.
It seems
paramount.
like first step. That's the first thing you need to do. Okay, so that looks like it. Well, let's see. We may have one question. If a person has or had cancer, should they keep an alkaline or acidic diet?
Well, cancer thrives in acidity, so the body really should be as alkaline as possible. When I talk about acid, I'm only talking about stomach acid, So you don't want cancer to thrive.
Mm-hmm.
But if you don't have enough stomach acid, you could get H. pylori, which is going to cause stomach cancer, one of the causes. And if you are a chronic antacid user, you could get stomach cancer because you're cutting so much of your stomach acid that you're allowing the good bacteria to grow, the bad bacteria to grow in the stomach. So while the body should be alkaline, and you don't want to overdo everything. Everything is balanced. Balance is key. But the stomach really should have enough acid because if it does not, the digestion will be off and disease can occur.
Okay. Dr. Boyle, do you have time for just a couple more questions?
Go ahead.
Okay. Can someone on Natra thyroid titrate off?
If you're taking Nature Thyroid, which is a thyroid hormone, a natural hormone, it was probably because, and I don't know who's asked the question, I don't know who's on it, so I don't know your history, but it was probably because your thyroid was hypo-functioning. If you are aging, your thyroid is going to age with you. if you're not making enough thyroid hormone, the thyroid is important for keeping your calories burning, keeping hair on your head, keeping you free from constipation, keeping your temperature set to the right place. So if you need it, and it's a natural hormone, take it. Just like, as people are aging with menopause and andropause, you age because you lose hormones. If you do not replace the deficiency, you are not balanced. But that's a whole other subject, with natural hormones. So I don't know. If you truly didn't have hypothyroid and I don't know why you would be on it. But if you did, you probably would want to be on that natural hormone to supplement.
Okay, thank you. And Nancy asks, can you speak to Hashimoto's and food allergies as a trigger? I guess for the Hashimoto's?
Well, Hashimoto's is an autoimmune issue. And like we said, 90% of autoimmunity would do better without gluten. That's in the medical literature.
Okay.
So is the gluten itself triggering Hashimoto's? We can't prove that, but we can prove that it makes it worse. Because anybody with autoimmunity does better without gluten. So that's telling us, because it's in the medical literature, 90% of people with any autoimmune disease do better without gluten. So that means it's a toxin. And if you immunologically react to gluten in your bowel and it microscopically leaves in the bloodstream and attacks the thyroid, that's when you get autoimmune thyroiditis. You make antibodies to your own thyroid, and that's Hashimoto's. Now, if somebody makes antibodies to their own thyroid, they usually get nodules, not always. But when those nodules grow, then we worry about thyroid cancer. So you want to clean the bowel up so that you don't, perpetuate the disease. And then you also may want to think about, a powerful antioxidant like glutathione to help the thyroid and help any autoimmune disease, because that's a good liver cleanse. And it's not taken well and absorbed well orally. It's an infusion. And we actually do that as well in the office here.
Wow. Okay. Well, Dr. Boyle, thank you so much for taking the time to present this information to us in such a clear and concise way, very understandable. We thank you for that. I'd just like to give you your contact information one more time. It is called Divine Awakening Healing Spa, and it really is quite a beautiful office. It is located at 736 Valley Road in Montclair, New Jersey. Their phone number is 973-509-7360. And Dr. Boyle, could you please just give the website one more time?
Okay, it's www.the-younger-u.com.
Okay, and if people want to contact you, is it best to call the office, or do you prefer email?
Usually we like contact by phone, but if they do email, we read the emails and we try to. We'll probably answer you by phone, I will tell you, because the staff is personable.
Yes, they have lovely staff there. So
we will probably answer that. But I do thank you for inviting me to speak.
Oh, it was our pleasure. And so, folks, we know we had some technical difficulties. The PowerPoints will be available. If anybody wants them emailed to them, just contact us at TDI. The webinar will be archived. So we'll try to get it together for you and get this information out to you. Again, Dr. Boyle, thank you so very much. And everybody who joined us, have a good evening.
You're welcome. Good night now.
Good night.